Hi docs, this is Dr. Ryan Beck. I'm coming to you from the Dry Eye Rescue Clinic, and today I'm going to be showing you my method of amniotic membrane placement for dehydrated membranes, which may be a little bit different than you're doing in your clinic today. We're going to be placing a single layer dehydrated amniotic membrane on a patient who has been suffering from recurrent erosions due to severe dry eye, and has really been helping out to have every couple of months, and this whole process has made it even easier for her to be able to tolerate. So as part of this process, there's a couple of different important steps. It's just for any procedure. First is we're going to clean and prep the area just to make sure that everything is not going to be potentially infected with bacteria or viruses or any different microbes. Afterwards, we're going to make sure that we have all of our supplies set between the amniotic membrane, the right forcep grips to be able to put directly onto the eye surface, proparacaine to numb the eye for prior, as well as medical tape and our sleep tight, sleep right patches to be able to stick down the lid and keep the tarsus shut for the 24 hours afterwards. The whole procedure goes really, really quick, so please pay attention, follow along, and you can replay this video as you need to. So, for cleaning the eye surface before, my preferred method is to use a hypochlorous acid spray, just to make sure that there's bacteria viruses, because it's a really great cleanser in a broad spectrum environment. So if you would, lean back, and I'm going to spray the eye gently. What's nice about hypochlorous acid spray is very, very mild, and that it can be sprayed even directly on the eye if patient can tolerate it, but especially with the eyelid closed, it's a non-issue here. Yeah, so we got everything cleaned up. There's a little bit of residual makeup, so I'm glad that we cleaned up a little extra just to get that off. Sorry, we won't be more in makeup for the next day on this eye anyway, right?
No.
All right. So we're going to instill 1 drop of proparacaine, 0.5%, just to make sure the placement goes a little bit easier. So if you look up to the ceiling for me. Perfect. And I'm going to give you 1 paper towel just to dab that while I get the rest of my supplies set up. Okay. So the supplies, the amniotic membrane comes in usually a sterile packaging. The one that I'm using for today is just a 10 millimeter round membrane. Usually that covers most of my dry eye patients, so that's significantly enough. And what we do to be able to get this prepped and ready is I have my Sleep Tight Sleep Right sticker, which I've already gotten out and ready. I have medical tape for helping secure it afterwards. I do have a Rene membrane grip to be able to help place the membrane, and for getting the actual membrane ready, as soon as we open it, obviously we get exposed to the air and the atmosphere, so I just gently get the exterior of the packaging slightly open, just so I can be able to slide the membrane in without exposing it, or slide the membrane grip in without exposing it to the atmosphere and the elements. So that eye should be feeling a little bit nice and heavy at this point, right?
Mm-hmm.
So the instructions that we give to the patient is to lean the head back a little bit, but looking straight ahead, and we use a visual acuity chart as a target for them to be able to look at, so it makes it easier for placement. When I'm placing the amniotic membrane, what I like to do is place it on the superior temporal edge of the cornea and limbus. It's overlapping a little bit onto the palpebral conjunctiva, but also, the bulbar conjunctiva, but also in the cornea surface as well. The reason why I do the superior temporal edge is because we have our lacrimal gland flow going from the superior temporal portion all the way down to the inferior nasal. So as the tear production happens, we're actually going to be dissolving the membrane, washing it across the entire eye surface, and then all those good healing proteins that are in the membrane itself will continue to help regenerate the tissue. All right, so in grabbing the membrane, I'll use the Rene membrane grip here. Kind of like a horseshoe forcep. And voila. So when we pull it out, we move fairly quickly just because it is flimsy, but there we are. Okay, so the instructions for you, June, is to lean back, looking straight at the television here. I'm gonna lift up your eyelid. I'm gonna place the membrane and flatten it out, just to make sure it goes on nice and even. If there's an occasional fold in the membrane, that's perfectly okay. When it's that far up underneath the lid, you usually don't feel it. Okay, June, I'm gonna have you close your eye. Okay, and we're gonna keep closed. Take my Sleep Right sticker and place it with the tab over on the temple side. And then just for extra security, I like to add one little piece of medical tape. The reason being is the whole goal of the patching method is to not let that membrane eject. We want it to continuously dissolve and absorb over the next 24 hours. And so as long as that stays closed and stays shut, then voila. And that's the end of the procedure. Thanks for taking a watch.